Good evening. Pediatric urology involves the management of genital and urinary problems that occur in children, with a special emphasis on development problems affecting the kidneys, bladder, urethra, or the genital tract. To know more about urology problems in children, we have with us today Dr. Jimmy Shad, consultant pediatric urologist at Apollo Children's Hospital, Chennai. Good evening, doctor.
Good evening.
What are the common urological problems in children today?
As you have already said, is a vast question. The common conditions that will involve the urological problems kidney will be related to the kidney, ureter, bladder, urethra, or the penis in the boy, in case of the boys. The various conditions, the very commonly seen is the tightening of the foreskin that we call as phimosis. Then is swelling in the groin. If it is in the groin, only the fluid collection is there, then we call it as hydrocele. If it contains intestines, that we call as hernia, that is inguinal hernia. Then is the condition related to, then there is undescended testes. Like we know in the male child, there are two testes in the scrotum. And either one or both of them may or may not be present, that we call as undescended testes. That is one of the very common conditions. Then there may be some obstruction into the bladder, in the part of the urethra that is commonly seen close to the birth, that is called a post-urethral valve. Then there will be problems into the bladder. In the kidney, there's fluid retention or the urinary retention in the kidneys that leads to that we call as a common word called as hydronephrosis. Hydronephrosis can be because of the various conditions. As we go along, we can elaborate the point of view. But these are one of the and there is a problem in the penis in the male child, that the opening that normally stays at the tip of the penis, whereas in such kids which I'm talking about is hypospadias, where the opening may not be at the tip of the penis, may be on the under surface of the penis along with the vent or the curvature of the penis. So these are the very common urological conditions that we see in the day-to-day practice.
What are the common symptoms of urological problem in children? For example, it could be a newborn child, it could be a toddler. How do parents identify that there is a problem?
See, it's not very difficult to identify problems in children. Specifically, we should be little, the parents just required to be aware of, definitely at the child of birth, definitely they require to a good checkup, because most of the urological conditions that we are talking about are congenital. That means they are acquired since or the problem in the development of the child. So they should be seen, at proper evaluation should be done. Then I can talk about few conditions, like the most commonly we will be presenting with urinary tract infections. The UTI, they can have pain while passing urine, the child will be excessively crying, or maybe passing urine more often, or may not be passing urine, or maybe too infrequent passage of urine. In undescended testes, if we talk about, the testes will not be apparent, so it will be apparent outside that one testes or both the testes are not there where it should be. If, like I told you about hydrocele, the fluid or that swelling will be there in the groin region, that should alert the parents. And urinary tract infection is one of the common conditions that they can easily be able to identify with.
You mentioned about hypospadias. Can you tell us a little bit more about it, please?
Yeah, hypospadias is conditions, as we talk in the layman language, it consists of three parts. As we see a normal phallus or the penis in a child, the point of passing of urine, that is called as the meatus, will remain at the tip of the penis. The one component will be that the urinary tip will not be on the tip of the penis, it will be on the under surface. It can be from the top, from the tip of the penis, either up to the scrotum where the testes lies. It can be anywhere. Second component is this curvature. There will be bending of the penis. The penis will not be straight, it will be bent. That is called as scody. And third, skin. The normal child has a normal skin cover. The prepuce, that we call as prepuce. The prepuce covers the glands, the tip of the cone or the cap of the penis completely all around. In such kid, it only be on the upper surface. That is called as dorsal hood. It is very easily diagnosed, and it is something that is happening more often nowadays.
Is it congenital?
Yeah, definitely this is a congenital anomaly.
And what are the factors that generally cause hypospadias?
You cannot point out one factor that leads to hypospadias, but what is commonly seen is increasing age that is happening with nowadays stressful life, the age of the, especially the late age of marriage, especially the age of the father. Plus nowadays a lot of IVF centers are there. That is a hormonal imbalances happening, can lead to hypospadias. Lot of electromagnetic radiation, electromagnetic, that is also more now, electromagnetic radiation exposure to the paternal side, to the father, that all are reason. But there are otherwise there's so many factors. Genetic genes also plays a part, but all these are common factors that leads to formation of the hypospadias.
Hydrolymphosis is something that you had mentioned earlier, doctor. Could you elaborate a little bit more on that?
Hydronephrosis.
Yes.
Hydronephrosis, as we talk in the common language, is the increased size of the kidney or the fullness of the kidneys. There are various reasons to have hydronephrosis. Isolated hydronephrosis, when it's only that swelling lies in the kidney. The commonest thing that we see in day-to-day practice is PUJ obstruction. That is obstruction as in the passage of urine from the kidney to the ureter. Urine is formed in the kidney, then it goes to the pelvis, is the collecting portion of the kidney. Then it goes to the ureter. Then the bladder is a storage organ, and then it passes urine, and that goes out from the urethra. So there is a problem at the right at the junction of the pelvic ureteric junction, like the junction of the ureter and the pelvis. That is one of the things that commonly seen in the kids. That obstruction is there that causes isolated hydronephrosis. Then there can be many conditions which leads to vesico-ureteric reflex. That is, as the urine travels normally from the kidneys towards the bladder, in certain conditions in the body, the urine goes backwards. That is, goes when the child tries to pass urine outside, it goes partly outside, partly is reflects back to the kidneys. From the bladder, it goes back to the kidney. In all those conditions, there can be many conditions, but commonly we call it that phenomena is called as vesico-ureteric reflux. Now, vesico-ureteric reflux can be because of various reasons. So these are very commonly seen. In those conditions, you will have hydroureteronephrosis, which includes vesico-ureteric reflux, and isolated hydronephrosis is because of PUJ obstruction. These two conditions almost every odd day we'll see.
What causes infection in kidneys in children, especially newborn and kids?
Then again, it is a big question, but newborns having infection is not common. Most of them, if they are having infection in newborn or a toddler having, most of them are associated with some or the other congenital anomalies. That is anatomical. But all I am talking about, having hydronephrosis or having hydroureteronephrosis, having problem in the bladder, having problem in the urethra, posturethral valve, most of them will have some of the other problems. Otherwise, in a normal healthy child, as the child grows up in adolescent and otherwise, or especially in the girls, because the urethra is very short, those adolescents or kids can have urinary tract infection without any anatomical problems. But if we are able to identify urinary tract infection in small kids, we should evaluate further. It is one common symptoms that leads us to various diseases. We should be smart enough to at least get them evaluated completely.
Urinary tract infection or UTI is a very common phenomenon in kids today. Can you tell us a little bit more about it, and can it be treated at home? Should we go to a specialist? What are the symptoms?
Very nice question. Definitely. Urinary tract infection, you can divide, as I talked about, one is infants or the newborn age group kids, and one is adolescents. So because both of them have different presentations, when you talk about younger kids or very small infants or newborn, definitely they should, if even one episode of urinary tract, or we commonly call as UTI, should be thoroughly investigated. You require to do a urine routine and urine culture. Along with that, definitely you should not stop at that. You should do a ultrasound of the KUB region that is called as kidney, ureter, bladder, or ultrasound of the abdomen. The belly should be done at least once. This has to be done. If you talk about adolescent age groups, UTI can be because of lot of unhealthy lifestyle, obesity, as we see, overweight, unhygienic condition, not drinking enough water. All that also are the reasons that leads to UTI in older age group.
Is it more common in boys or in girls?
If we talk about adults, nature prevents girl child from most of the problems. So mostly if you see about the younger age group, mostly the boys will come because they will have more of congenital anomaly. Girls are preserved by the God. Whereas we see the other way around when you talk about adolescent, because as I told you before, the urethra, that passage from where that passes from the bladder to outside is called as urethra. That is pretty small in a female. So there are more chances of having a UTI in a female child at adolescent age group, whereas a younger kid will be mostly the boys will having more.
What can parents do to prevent UTI in children, specifically boys?
See, evolving a good healthy lifestyle is a key for everything. So definitely you should take enough of water, drink a good quantity of water, do regular exercises, don't be overweight. Obesity is a reason for everything. So not if you drink less of water, that also adds to one is common condition called as constipation. Constipation is one of the things that predisposes them for UTI because the bladder emptying becomes a problem. And proper, if you talk about the younger kids, definitely proper toilet training is the key for preventing them from going through most of the problems. If we talk about I talked in the first disease called as phimosis, that a tight foreskin at the opening of the penis, that the prepuce covers the glands. So that should be normally when you to give regular bath, and so it should be opened up and should be cleaned every day. That is one small simple exercise while giving a bath to the child. If you open it up and clean them every time, it normally that skin start opening up, which it doesn't open and leads to phimosis.
Thank you, doctor. What is an overactive bladder, doctor?
Overactive bladder is a functional abnormality of the bladder in which a child or a man or a female is not able to control the desire or the urge to pass urine, and they leads to a condition where you can even leak or become incontinent. Incontinent means they're not able to control their passage of urine. So that is labeled. It is a vast symptom that they'll have a more of frequency passing repetitive urines.
That is one of the symptoms of
Yeah.
an overactive bladder.
Yeah.
And how common is it in children today?
It's quite common, as I told, because unhealthy lifestyles, eating more of snacks. Obesity is one of the conditions that predisposes them for overactive bladder. Plus, there are so many neurological conditions also. But we talk about overall bladder, we take in consider there are otherwise normally healthy kids. So normally it is constipation, which is one of the factors which predisposes them, obesity, not drinking enough water. So these are one of the few common things that predispose them for the conditions.
And are there any specific treatment options for overactive bladder?
You have to, it's a group of conditions we have to examine, we have to label them, and we have to plan the treatment accordingly. Mostly you drinking enough of water, doing proper toilet training, exercise, eating enough of fibers in diet, and avoiding constipation. And we have to evaluate them, then we have to plan and give them their specific pelvic strengthening exercises that also have been taught about. If they are still not manageable, there are other modalities are also there. There are biofeedback urodynamic studies which will tell us about the bladder strengthening, bladder strength, pelvic muscle strength, and their treatment modalities.
Thank you, doctor. That was very detailed. What are the consequences if urological problems, say hypospadias or hydropnesis, if they're not treated at the right time?
It is fast thing, but definitely all of them have to be treated. All these conditions what you are talking about has to be treated and has to be treated on time. Hypospadias definitely is as I talked, you cannot left untreated only where because child will not be able to reproduce, and because you cannot just take a child as a child that has an important organ of the body, and he has to reproduce. So when the ventral curvature is there, he cannot reproduce. That is one aspect of it, and there is a lot of pain and other problems get associated along the child grows. And then if you talk about hydronephrosis, the function as the way that there is obstruction in the flow of urine from the kidney to the ureter and to the bladder, that obstruction has effect on the bladder function. So eventually, that was a treatment modality. Is we also plan treatment according to when we do studies and we see the function of the kidneys, and the criteria of treatment only depend on the how much the function of the kidney is getting compromised. So they will lose their vital kidney. Kidney is important for the survival. So if you're not able to treat them on time, you may lose the vital functions. As the kidney is growing age, in initial the nephrogenesis goes on from birth to initial 4 years of life. So that is a very critical time period. If we talk about undescended testes, if the testes are not down, God has kept them down because they require a cooler environment for growth and for spermatogenesis. That is important for the progeny, for the reproduction. So anything, it has to be managed between 6 months to 9 months of age. If they are not operated in before that, if they had to come down, we can still initially wait for a few months. If the testis has to come down, if it doesn't come down, it has to be operated before 6 months to 9 months of age, depending on the thing, is one-sided or both-sided. Otherwise, they will not be able to reproduce as they grow up. So it is quite scary,
We've got a lot of questions from anxious parents about bedwetting by their children, and it comes from parents who have kids as young as 2 years old to 13 years old. So could you tell us a little bit more about it, please?
Bedwetting, 2 years we will still not consider them as bedwetting, because although in the way we compare with the Western world, they keep on putting diapers even for 4 years, 5 years kid. Although average age of getting toilet trained in India is hardly 18 months, 1.5 years. The Indian kids are toilet trained quite early. But still, if they're wetting the bed at 2 years, we don't consider them bedwetting. But bedwetting is a condition, very few, less than 5% of the kids will have any pathological or problem associated which leads to bedwetting. Bedwetting, as you can, by the word you said, that the child is wetting the bed in the night unconsciously. So most of them are does not have any metabolic or any other conditions. So normally they require a good, nice counseling is the most important things, because as we know that our body has a circadian rhythm. Child is little lazy to understand, so it has to be counseled softly. There we have to plan their diet, plan their time for their eating food. You have to give them, restrict their fluid intakes, and you have to, some of them do require help, do require drugs also for the management.
Thank you, doctor. Is it very common today in youngsters as well, as in children who are over 6 years old? We have one question from a mother who's asking, he's 7 years old and he's still bedwetting. So how can that be treated?
Definitely, I think first thing they have to go and consult a physician or a urologist for the problem, because there are various reasons to bedwet. Not just one reasons you really require to see. It can be as vague as maybe they're not having a toilet within the room where they sleep. You just keeping a light off in the night. Child may not be okay enough just to get up in a dark room. So there can be some silly reasons also to bedwet, to a point that he may harboring some sort of pathology within. So you really require to investigate. Sometimes a smaller, simpler advice. So it definitely good, nice history of talking to the child is important to know what is his reasons. Some of them are intimidated by the parents or their peer group kids. That also leads to stress factors. Everything you have to child. It's not a thing, and you have to find out a reason behind betting the bet. Sometimes they are getting scolding also too much. It's like modality is a stress factor reliever also. So you really work on it. You have to find out a reason, but most of them, I can tell you, most of them does not have pathological problems. Most of them do get away by basic management, or the basic we require to improve on their physiology. That is the basic thing the body requires to put into place. They may be doing something. Proper toilet training is a key to stop bedwetting.
Hello, doctor. This is regarding my 5-year-old daughter. We have found in news recently that there are some vaccines which are not good for children, which might cause erectile dysfunction in children. Can you please let us know?
I see whatever the I'm not the right person to talk about vaccines, but I don't think so. There is any WHO recommended regime vaccine that causes erectile dysfunction. So I will say it does not happen at all. It is definitely not the right thing.
What is bladder dysfunction, doctor?
Whatever we are talking about is a part of bladder dysfunction. If you talk about overactive bladder, you are talking about, I think, bladder dysfunction, dysfunctional voiders, or even bedwetting. These are all bladder dysfunction part of it. When we precisely talk about dysfunctional voiders, is like when we normally urinate. So pelvic muscles has to relax. That is when the bladder contracts to let the urine out. The pelvic muscles should relax so that the urine can be flows out. In these kids, the pelvic floor muscles are overactive. That means when our bladder is contracting to egress the outflow of the urine, they are also they are dyssynergetic with the phenomenon, and they are also contracting. So it causes the obstruction in the flow of the urine. So it is again, you first has to do a complete evaluation of the spine or the neurological evaluation of the child to label them dysfunctional voiders. All these kids can have subtle or occult type of neurological conditions. First, once they are free from all the neurological conditions that we have required, the spinal abnormality, then you label them as dysfunctional voiders. And definitely, precisely, you have to find out the reasons behind the dysfunctional voiding habits. As I've said before, the common thing is good healthy lifestyles, having enough of fibers in diet, drinking enough of water, getting good toilet trained, passing motions every day is the key for getting rid of all these problems.
Can you please elaborate a little bit on what are the latest treatment options available for various urological problems at Apollo Children's Hospital, Chennai?
See, as I can tell you, most of the conditions now, if we talk about the surgical conditions, so we can say that most of the conditions are being treated by minimal assisted techniques. Most of them, some of the which we include in natural orifice surgeries, like even for the obstruction in the urethra, that is called a post-urethral valve. So you go for cystoscopic fulguration of valves. Any condition on the bladder, normally for the reflux and all that, either you go for laparoscopic or robotic reimplants. Even condition in the kidneys are treated by laparoscopically or robotically. Even any sort of stones, anything, we normally are being managed by endoscopic measures. That is we call as natural orifice surgeries. So most of the conditions as of now are in urology is precisely endoscopic, laparoscopic or robotic managements.
What would be your message for our viewers today, doctor?
I will say today the parents should be little aware, smart. Like if you are a fresh father or mother, definitely you should see the child. You should examine yourself and you should get them evaluated properly at a good by good physicians. At least the basics things can be done, evaluated. The testes should be there. Everything, all the obvious congenital anomalies can be cleared up. For rest of the things, living a good, healthy lifestyle is a key for getting rid of all the problems. Definitely, the urological problems are quite closely related to a healthy lifestyles. Not putting too much of weight, drinking enough water, eating enough of fibers in diet, got good toilet training, passing urine timely, that is we called as time warding, means regularly passing urine every 1.5 hours to 2 hours of time, and yeah, and not constipated. I think this is the basic things that you can give a basic healthy lifestyle to the child, and will avoid most of the problems.
Thank you very much for a very informative session, Doctor. For appointments with Dr. Jimmy Shah, you may contact 044 2829 8152 or 8153. I repeat, 044 2829 8152 or 8153. Thank you very much, Doctor. Thank you,
Thanks.
viewers.
Thank you so much.